Ready to get to the truth about bioidentical hormones? Wondering if they're the key to hormone balance or just a marketing buzzword? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Let's dig in. So, what are bioidentical hormones? Bioidentical hormones are hormones that are chemically identical to those naturally produced by the human body. They are typically made from plant sources, like yams or soy, and are modified in the lab to match the molecular structure of the hormones found in our body. This is different from some synthetic hormones, which may have a slightly different chemical structure. These hormones are often used in hormone replacement therapy to treat symptoms of hormone imbalances or deficiencies, such as those occurring during perimenopause or menopause. Some examples include estrogen, progesterone, and testosterone. While some people prefer bioidentical hormones because they're thought to be more natural, there is ongoing debate and research about their safety and effectiveness compared to conventional hormone therapy. It's important for people to discuss these options with their prescribers to make the most aligned and informed decisions. So, how are these made and used? The chemical structure of a hormone remains the same regardless of whether it's derived from a natural source or synthesized in a lab. The term bioidentical is more of a marketing label than a strict scientific definition, and it has created some confusion and debate. From a technical standpoint, bioidentical hormones refer to substances that are chemically identical to the hormones produced by the human body. The key aspect is that they match the molecular structure of the body's natural hormones, such as estrogen, progesterone, and testosterone. However, the term bioidentical can be misleading because while these hormones are often derived from plant sources like soy or yam, the fact that the final product is chemically identical doesn't necessarily make it more natural or inherently safer. The process of modifying these plant-based compounds to create the final hormone still involves synthetic methods. The word bioidentical has been widely used in marketing to differentiate these hormones from synthetic versions, but it doesn't necessarily mean that they are superior or better for everyone. It's often used to create the impression that these hormones are more natural, which appeals to some patients, especially those who are cautious about synthetic products. But the FDA doesn't regulate compounded bioidentical hormones as strictly as other hormone therapies. In fact, compounded bioidentical hormones made by a pharmacy to specific prescriptions are not FDA approved in the same way that commercially available hormone treatments are. The medical world is divided on bioidentical hormones. Supporters highlight benefits like lower risks of breast cancer and cardiovascular disease compared to synthetic hormones. And some patients report higher satisfaction with bioidentical progesterone in hormone replacement therapy. But there's another side to the story. The Endocrine Society, where hormones are their thing, states that there's little evidence to back claims that bioidentical hormones are safer or more effective than traditional hormone therapies. And long-term safety studies are still lacking. Compounded bioidentical hormones, while tailored, carry risks. There's the lack of FDA oversight, leading to inconsistencies in dose and purity. The health risks are similar to traditional hormone replacement therapy, like stroke and blood clots. And these compounded formulations could potentially interfere with diagnosing serious conditions like autoimmune disorders. Remember, bioidentical and natural don't always mean safer or better. So what does science and data have to say about all of this? Well, there's promising research, but the jury's still out. While bioidentical hormones show potential for lower cancer risks and better patient outcomes, the lack of regulation and long-term studies leaves room for caution. I hope your brain is full of bioidentical goodness, no compounding required. If you're considering bioidentical hormones, consult a knowledgeable healthcare provider to weigh the risks and benefits. Be sure to grab more tasty tidbits at brainbiteswithdrbee.com. Enjoy!